Welcome to today's lecture on the fascinating field of radiology, specifically focusing on the principles and applications of ultrasound imaging. In this comprehensive script, we will delve into various topics related to ultrasound physics, transducer technology, beam formation, image acquisition and optimization strategies, tissue interactions, Doppler ultrasound, artifacts, display modes, safety considerations, quality assurance, ultrasound-guided interventions, and cutting-edge advancements in ultrasound technology. So, without any further ado, let's begin our journey into the world of ultrasound. Ultrasound imaging operates on the principles of sound waves. Sound waves are mechanical vibrations that travel through a medium, such as human tissues. These sound waves are generated by piezoelectric transducers and propagate through the tissues. Understanding the physics behind ultrasound is crucial for proper interpretation of images. Concepts such as frequency, wavelength, amplitude, propagation speed, and echogenicity will be discussed in detail. Transducers are the essential components of ultrasound machines that convert electrical energy into sound energy and vice versa. Different types of transducers, such as linear, curvilinear, phased array, and intracavity transducers, are used for different imaging purposes. We will explore the technical aspects of transducer design, including the number of elements, frequency ranges, and focusing capabilities. The ultrasound beam is formed when sound waves are emitted and focused into a narrow, cone-shaped beam. This beam's characteristics, such as beam width, beam shape, and beam steering, can be adjusted to optimize image resolution and penetration depth. We will study the factors influencing beam formation, including beam-forming techniques, focusing algorithms, and time delays. To obtain high-quality ultrasound images, optimal acquisition techniques and settings must be employed. This topic will cover a range of factors, including depth selection, gain control, time gain compensation, dynamic range, persistence, grayscale mapping, harmonic imaging, and compound imaging. We will explore how variations in these settings affect different anatomical structures and pathologies. Ultrasound waves interact differently with various tissues in the body based on their acoustic properties. Understanding these interactions is crucial for accurate diagnosis and interpretation. We will discuss concepts such as reflection, refraction, scattering, absorption, and attenuation, as well as how these phenomena contribute to image formation and image quality. Doppler ultrasound is a specialized technique used to assess blood flow within the body. By detecting changes in the frequency and amplitude of sound waves reflected from moving red blood cells, Doppler ultrasound provides valuable information about blood flow velocity, direction, and turbulence. We will explore the principles of Doppler ultrasound and its applications in different clinical scenarios. Ultrasound imaging is prone to various artifacts that can potentially lead to misinterpretation and diagnostic errors. We will discuss common artifacts such as acoustic shadowing, edge shadowing, reverberation, mirror image artifact, and speed error artifact. Understanding these artifacts is essential for differentiating real anatomical structures from false or misleading appearances. Ultrasound machines offer different display modes that visualize image data in specific ways. We will cover commonly used modes, including B mode, brightness mode, M mode, motion mode, color Doppler, power Doppler, and spectral Doppler. Each mode provides unique information and aids in the evaluation of different anatomical structures and physiological processes. Ultrasound imaging is considered safe and non-invasive, but proper safety precautions must be taken to ensure patient well-being. We will discuss thermal and mechanical indices, bioeffects, exposure limits, and guidelines to maintain safe ultrasound practices. Understanding these safety considerations is paramount for all ultrasound practitioners. Maintaining consistent and accurate ultrasound images requires ongoing quality assurance protocols. This topic will cover aspects such as equipment calibration, image quality assessment, transducer cleaning and maintenance, documentation, and quality control measures. Emphasizing quality assurance measures ensures reliable and reproducible ultrasound examinations. Ultrasound imaging plays a crucial role in guiding various interventional procedures, such as biopsies, aspirations, injections, and drainages. This section will explore the use of ultrasound guidance, including patient positioning, target localization, needle visualization, and real-time monitoring. Understanding these techniques enhances the safety and success rates of ultrasound-guided interventions. The field of ultrasound is rapidly evolving with technological advancements. This final topic will provide an overview of recent developments, such as 3D and 4D ultrasound imaging, contrast-enhanced ultrasound, elastography, fusion imaging, and artificial intelligence applications. These advancements expand the diagnostic capabilities and improve patient care in the realm of ultrasound. In conclusion, Ultrasound imaging has revolutionized medical diagnostics by offering a safe, non-invasive, and versatile imaging modality. By understanding the principles of ultrasound physics, optimizing image acquisition, recognizing artifacts, and utilizing cutting-edge technologies, radiologists can provide accurate diagnoses and guide interventions with confidence. As future healthcare professionals, your proficiency in ultrasound will contribute significantly to patient care in the ever-evolving field of radiology. Thank you for your attention, and I hope you find this script informative and beneficial in your journey to becoming skilled users of ultrasound technology.